Good afternoon, students. All are well now. Study well and take down the notes. Today I will be dealing with the handicapped children welfare services for challenged in India. The following schemes are being implemented by the government for welfare of persons with disabilities. There are many schemes are implemented by the government for the welfare of these challenged children. First one is Deena Dayal Disabled Rehabilitation Scheme, DDRS, Deena Dayal Disabled Rehabilitation Schemes. In this scheme, there are projects like Special School for Disabled, Vocational Training Centers, halfway homes, community-based rehabilitation centers, early intervention centers for disabled. These all schemes under this Deena Dayal Disabled Rehabilitation Schemes. Project like Special School for Disabled, Vocational Training Centers, halfway home. It is halfway home. Halfway home is home for people to stay limited period of time. Example, mentally ill patient. Halfway home is for people to stay limited period of time. Then community-based rehabilitation centers. Community-based rehabilitation centers is people with disabled have same rights opportunity as all other members of the community. These people also have same rights opportunity as other members of the community. Example, health care, education, skill training, all these matters same rights and opportunity as other people. Second one is assistance to disabled person for purchase or fitting of aids and appliances. Assistance to disabled person for purchase or fitting of aids and appliances, ADIP. Under this scheme, aids or appliances are distributed to the needy persons with disabilities, which include mentally challenged children. They will give the appliances and aids to the needy people with disabilities, which include mentally challenged children. Then national institution. Ministry supports 7 autonomous national institutes which provide rehabilitation service for different types of disabilities. Ministry supports 7 autonomous national institutes which provide rehabilitation service for different types of disabilities. Fourth one is National Handicap Finance and Development Corporations. Corporation provide income generating activities for self-employment. Then fifth one is Scheme for Implementation of Person with Disabilities. Equal opportunities, protection of rights, full participation. Scheme for Implementation of Person with Disabilities Act in 1995. Under this act, assistance is provided to setting up of district disability rehabilitation centers. Giving assistance to provide for the setting up of district disability rehabilitation centers, regional rehabilitation centers. Their responsibility is creating barrier-free environment in public buildings and awareness generation. They will remove all the barriers in the environment and conduct awareness programs. Sixth one is schemes for incentive to employees in the private sector for providing employment to persons with disabilities. example, employee provident fund, employee state insurance, etc. Next is what are the institutions? The central government has established 4 National Institute for the Rehabilitation of Handicapped. Central government started 4 National Institute for the purpose of rehabilitation of handicapped. First one is National Institute for Visually Handicapped, Rajpur Road, Dehradun. The National Institute for Visually Handicapped, Rajpur Road, Dehradun. Second one, National Institute for Orthopedically Handicapped, BT Road, Gonhujli, Calcutta. Third one, National Institute for Mentally Handicapped, Manovikas Nagar, Vendrimpalli, Secunderabad, Andhra Pradesh. Fourth one, National Institute for Hearing Handicapped, AC Mary, Bandra, Mumbai. These are the central government National Institute for Rehabilitation of Handicapped. Then there are several rehabilitation service centers which are also engaged in research activities. The research activities conducting rehabilitation centers are many. Some important centers are All India Institute of Medical Science, New Delhi, Vai Man Singh Hospital, Jaipur, Medical College at Trivandrum, Regional Artificial Limb Center, Lucknow, St. Martha's Hospital, Bangalore, National Institute for Mental Health and Neurosciences, Bangalore, then Nair Hospital, Bombay, PG Hospital, Calcutta, Artificial Limb Manufacturing Corporation, Kanpur. These are the rehabilitation centers, the national level. Next, we'll see what are the rehabilitation centers. District rehabilitation centers. In order to serve disabled in rural areas, government has set up district rehabilitation centers. In order to serve the rural people, government has set up district rehabilitation centers. Under this scheme, each village consisting of 1,000 people has been assigned a village rehabilitation worker. Under this scheme, each village consists of 1,000 people has been assigned a village rehabilitation worker to identify the needs of the disabled persons. They assigned 1,000 people in a village to identify the needs of disabled persons. It also helps the disabled to get aids and appliances. They will provide aids and appliances. These centers provide advanced physical restoration, vocational counseling, and professional manpower training services. These district rehabilitation centers provide physical restoration, vocational counseling. They need counseling, they will give the counseling. For the physical and restoration and vocational counseling and professional manpower training services also they will provide. Presently, district rehabilitation centers are functioning at Bhiwana in Haryana, Bilaspur in MP, Chengalpet in Tamil Nadu, Kota in Rajasthan, Mysore in Karnataka, Virar in Maharashtra, Vijayawada in Andhra Pradesh. Second one is vocational rehabilitation centers. Vocational rehabilitation centers. 17 vocational rehabilitation centers for the handicapped are function in different countries. There are 17 rehabilitation centers are function in different countries. Main purpose of these centers is to assist the residual capacity of the physically handicapped